Thank you, Marinette. Hi, Donna. Nice to see you again.
Nice to see you too, James.
Getting used to seeing you virtually. Well, welcome everyone who's on the webinar today. This is episode 2 today, and one of the questions that's already popped up on the screen is, are we going to do more? And you know, we've talked about it. There's just such a hunger and a thirst for information right now. We think we're going to keep this Wednesday at noon time slot until our audiences go to zero, where it'll take us off the air. So that's my first comment. Second is, we received some great feedback this week from all of you. We welcome back those who listened to episode 1 and welcome our new listeners. But you really wanted more of an interactive format. So what we did is we got about over 100 questions today or over the last couple of days. And we categorize those into areas that I'm going to ask Donna on the legal side, and I'll give my operations input. And we think we'll have captured a lot of your questions in that, and we're going to do that in the first half of the show. And then this week, at your request, we welcome anyone to use the QA function on your screen and send them in. And if your question isn't specifically answered, it's probably because we had several that were like. We did get some questions about, you know, the medical side and the health side, and it's not something we are going to do this week because Donna nor I are experts in that. But if we continue to get that, we may consider, you know, bringing on an expert in that in future episodes. I also wanted you to know we have people on this webinar from all over the Southeast and Texas. However, it's primarily from Florida. And so most of our answers will probably be Florida biased. And with that, I also like to say, you know, Donna's obviously an expert attorney in our field, but the purpose of this is really a conversation that we hope get you to ask your own attorneys the right questions. So there's no legal advice here. Any opinions I'm giving are mine and Castle's. They aren't necessarily your association may have different advisors, and so obviously you should always obtain that legal advice. And then finally, before we jump in here, I've already been asked, you know, I missed last week, how can I see it? So if you go to castlegroup.com and it automatically will pop up the hurricane. I'm used to hurricanes.
Well, it's almost hurricane season, so.
No, yeah, wait till we have a hurricane and a coronavirus. But anyways, we're going to have all the episodes up there if you are that excited and want to listen to them again. So the only other thing we didn't mention is sometimes on these webinars, you'll go, all of a sudden I can't hear or I can't see. Our best advice to you is log off and log back in. It often, you know, we have 300 or 400 people on this probably, and you're all on different connections. So please do that first. So with that, Donna, did I miss anything kind of in introductory remarks? And I'll let you talk, and then I'm going to just give a kind of an update from last week to this week before we jump into questions. Anything to add, Donna?
Well, yeah, we're going to cover a lot of territory. Last week, which was our first episode, we were really still in what I think of as the primary phase of this pandemic hitting our associations. And this is true across Florida, across the country. The first phase was, what do we do? What should we be closing? What kind of protocols should we be enforcing as a board to minimize the risk of COVID-19 spreading throughout the community? So we spent a lot of time talking with clients. I'm sure, James, you and all your managers did as well, as what should we be doing as the reality started hitting everybody that it was not going to be life as normal in associations for the foreseeable future until we get a handle on the growth of this virus. So we talked about common area closures. I know we're going to talk a lot today about pools, and I have very strong opinions on pools, which I'm going to continue to express in our series because it's that important. We talked about social distancing. We talked about heightened sanitization protocols. So I think one of the things we want to discuss today is how well is that going? You know, all the steps you took in place over the last few weeks, are you finding everybody's complying? Or you're finding that the people who violate most of your rules, you know, the typical rules, parking or pets, are violating your COVID-19 as well. And the second part of the phase that I think we're entering into now is enforcement, if people aren't following COVID-19, and looking forward to what the economic impact of this pandemic is going to have in terms of our association operations.
Excellent, Donna. The one other comment we had from last week was, there's a more of an impact of this pandemic on condos than HOAs, but I think there were a lot of people in HOAs that wanted us to go there as well. So you can see on your screen, these are the types of topics that you asked us to talk about. A quick update I'm going to do right now. Now we're getting confirmed cases. What do we do? We're getting a lot of questions about people who have lost their jobs, can't pay their maintenance. So Donna and I are going to talk about what we think you should be doing to make sure that the association is financially sound. And then we're getting regulations coming at us faster than you can imagine. So we'll talk, we're all in different geographies, so we'll talk about that more generically. The CARES Act is, the biggest government intervention we probably ever had in our lives. So we'll talk about that. Donna mentioned amenities, community access. We're getting a lot of questions about who should we let into our community, what can we do about it? And then not surprisingly, we're having a lot of questions about, look at our team on site. Can they be here? Can't they be here? How are we protecting them? What are good policies for the employees? And then finally, if we haven't addressed it we'll make sure we hit any differences between the HOAs and the condos. So let me start with a quick update. Obviously, we're approaching 1 million cases in the world. You see that in the news. 190,000 now in the US. The US always likes to be number one in everything, and this is one I wish we weren't, but we are. We're almost at 7,000 in Florida. I think the thing that, Donna, you mentioned that's really becoming crystal clear is we just need to do what we're being told to do. Personal hygiene, social distance, close amenities, and stay at home if you can.
And quarantine if you're coming from a hotspot down to Florida, as tens of thousands of people have done in the last week.
Yeah, it's a great point. Donna, we got a lot of questions on that. Is what, in fact, I'm going to kind of flow into what do we do when we get cases and whatnot. But one of them is, look, we have all of our people coming back, Florida, probably to get out of New York. How do we deal with that? But I want to come to that question in a minute. And then a new one on you talked about closing amenities. We'll get to is we have situations where a valet in one of our counts was confirmed case, and think about the implications of that. Should we be closing valet as an amenity? So we'll get into that. And then there were some questions already about when should we start reopening stuff. And I'm going to suggest to you that's a future episode. We're not going to talk about that today. Donna, the first thing I think everyone's really, because becoming so real for us is, okay, we now have a confirmed case in our community. And what Castle's done is we have a site response plan. It's been vetted by many attorneys. And the first thing we do, and I think this is super important for all of the board members on this webinar, you have a call as the president or your entire board with your attorney, with your property manager. And then at Castle, we always put one of our senior executives on that call and say, this is our recommendation, subject to legal counsel. And that really is the moment where you start putting the plan we're about to talk about in place. But Don, I just want to stop there. We have a case. You've seen the Castle site response plan, and you don't need to comment on that specifically, but from a legal perspective, what should boards be doing the moment they learn there's a case in their community?
Okay, so James, the first thing is, how did you learn about the case in your community? We don't want any board going off half-cocked because somebody told them they think this person has been exposed or tested positive. So it's a completely different game plan. You need to have credible reporting that somebody has either been exposed or that they've tested positive. And frankly, the most credible reporting is self-reporting. The person picks up the phone, they call the board or they call the manager and they say, I've been exposed, or a member of my household has been exposed, or I've tested positive, or a member of my household has tested positive. Assuming we have credible reporting on which to base a decision, the next step is, do you disclose? There is a foreseeable risk because this, and again, we're not medical experts, we're not giving medical advice, but the CDC guidelines and all the emergency orders have all stressed the fact that this is a highly contagious disease. So there is a foreseeability that if you have confirmed cases in your community and they are not properly quarantining, there's a risk of community spread. So we do recommend that you notify, but you notify based on a discussion with legal counsel. Certainly we fold management into that in terms of how to distribute and disseminate that information, and your site plan is excellent. We do tell people that there is a confirmed case. We do not name names. I do not recommend naming floors, because the reality is by the time you have that confirmed case, chances are you have multiple exposed individuals and multiple individuals who may be positive and just are asymptomatic and have not yet been tested. So the way you frame and phrase that notification is extremely important. You don't want to create panic. Again, your community is looking to the board for leadership now more than ever. So it needs to be phrased in a way not to create panic, but I do think notification, James, is a wonderful opportunity to let your members know why you took the steps you took. I know there's a lot of grumbling that the clubhouse is closed. I can't have private events, and we're going to talk about guest visitation. I can't have guests. I can't swim in the pool. When you have a confirmed case, it has been my experience 10 times out of 10 that people then get it. Then they understand why the board implemented and management implemented the stringent protocols that they did. So I use that notification as an opportunity to say, here are our protocols. We ask that you all adhere to them.
Yeah, I think if I could just kind of summarize that, if I'm a board member listening, number one, you immediately act. Number two, you don't do anything without your attorney's blessing, because you never know what's going to happen after this. You know, we often ask ourselves, when this is all over, what lawsuits are coming in and how can we act intelligently now to make sure we've covered that. And every resident needs to know immediately, and they won't know who that is. They'll just know it exists in the building.
But James, let me just jump in there, because chances are, and it's been my experience, that if somebody has tested positive, people have friends and neighbors that are in their social circle in these buildings and in these communities. So they already know. So if it's spreading, if they've told somebody that they've tested positive and the community doesn't hear from the board is absolutely silent on this issue, that's a problem as well.
Yeah, and I think something else you said is fact versus rumor. We have had several associations where it's been a rumor that someone has been infected, and that it turned out not to be true. So we have to make sure that it's fact. The other thing I'll tell you, and we have several confirmed cases now at Castle Properties, and in all now currently, and this may not last forever, 100% of those, the sick person has volunteered the information, been incredibly cooperative, and we'll talk in just a minute about what specifically we do with that situation, depending on whether it's a condominium or an HOA. But something you mentioned last week was official communication channel. It's super important, if you haven't already, and you probably have, is make sure the residents know how you're going to communicate. Is it a posting on your website? Do you have some kind of e-blasting mechanism? Are you still posting at the appropriate posting places in your community? But the resident won't know if they don't know where to look. And so that official communication channel you mentioned last week, Don, is super important.
Yeah, and one thing, because this topic is so important, is that if you were to name a name, let's say the owner actually said, go ahead, I want you to tell people, or go ahead, tell them what floor. I think that provides a false sense of security in a large community. Oh, okay, I'll just stay away from Mrs. Jones on the 12th floor and I'll be fine. That's the real problem here, is providing a false sense of security. We cannot know the extent of spread of this virus in the communities. People have to assume it's in the building, and that is why they have to strictly adhere to the protocols that have been put in place.
Yeah, so this brings us to a new development in this discussion, and that is we now have a confirmed case, and they aren't self-isolating. They're walking around the common areas. How do we enforce this? That's clearly a violation of all kinds of rules. But our boards now want to know, what do we do if we do have a case and that person is not self-isolating?
Yeah, it is a great question. And I think this particular issue is one that's going to grow increasingly important in the coming weeks. Number one, all the experts have said that we're going to be hitting peak in about 2 to 3 weeks. They also say that Florida is going to be the next New York. in terms of being an epicenter, in terms of an increasing number of infections and deaths. So next 2 to 3 weeks, we're going to be in a perfect storm because the people that have been homebound are going to be going stir crazy, but we're also going into the peak risk period for this virus spreading in our communities. I actually made a little note here. The first thing people are going to want to do is contact the local Department of Health. Now, there is language there that says any person in the executive orders, any person who violates any isolation or quarantine directed by the Department of Health commits a misdemeanor of the 2nd degree, punishable by imprisonment not to exceed 60 days and a fine of up to $500. So this is a crime. If you've been ordered to be quarantined because you've been exposed or infected, and you're ordered to be quarantined and you're walking around, you are potentially committing a crime. You can contact the Department of Health. It goes on further to say it's the duty of every state and county attorney, sheriff, police officer, and other city and county officials to enforce the Department of Health's quarantine orders. So one option is to contact the Department of Health, contact local law enforcement, and let them know that somebody is violating your order. What we have seen, though, is that help is not always going to be forthcoming. Okay, that's one avenue, certainly, but that may not be the most direct avenue to solve your problem, depending on how stressed out the local Department of Health is in terms of personnel and your local law enforcement. So this is a violation. It's certainly not a trivial violation. It's not the same type of violation as parking in the wrong spot. If you've got somebody who's infected or exposed and they're wandering freely in your community in violation of your protocols, that's a grave violation that needs to be acted upon immediately. I would suggest contacting your attorney, getting a legal demand letter out immediately, letting them know. And if they still continue to commit the violation, then proceeding with potentially an emergency injunction. But I will tell you, James, we're already writing those demand letters, and 9 out of 10 times, that's what people need, that wake-up call to let them know this is not business as usual. This is serious, and you are potentially committing a crime by walking out of your unit when you've been ordered to quarantine.
I think this is really important. I'm always thinking of what our audiences are taking away from each of our episodes, Donna. And, I can't tell you how many of our board members that are in the audience asked this question. So number one, you inform the health department. Number two, this is a legal issue in addition to our normal association violation. So I think what you're saying, this is so serious, we go with all guns a-blazing from all fronts.
Right.
And no delay. And I think it's surprising to a lot of board members that we actually have this much authority due to all of these orders that have been issued. Now, how does that apply to, I hate to pick on New Yorkers because that's not fair, they're having a tough time up there, but we have so many of our great friends from New York coming down here and probably, in fairness, wanting to come down to get out of the situation up there. But we know that we have an order in Florida where we're supposed to quarantine if we're coming from New York for 14 days. Are you including that directive in your violation discussion?
Yes, I am. And as you know, it's funny. I was talking to a client yesterday, and there's a humorous aspect to this, but really, this is all serious because we're talking about life safety. Client calls. We think we've got New Yorkers at the pool. I said, well, how? He said, they look pasty. So that's not good enough. But another client called and said, we definitely have people who came down from New York. They came down 2 days ago. They're supposed to quarantine. They're not quarantining. My question was, how do you know? He said, I've attached the key fob activity list. And to me, that was astonishing because they got in 2 days earlier and their key fob activity report showed that they had been all over the building within 2 days. My point, and you reiterated it, James, is don't wait for one particular path to solve the problem here. This is so significant that yes, you should contact the Department of Health. Yes, you should contact local police to see if they are enforcing the DOH's quarantine orders, but also contact your attorney. Take several different paths to get to the result. Whichever one gets you there quickest, perfect. If you start out with the legal demand letter and then the sheriff comes knocking and solves the problem, perfect. Then you get off the legal path. But if the sheriff is not coming out, at least you've got that legal path going where you know you can shut it down, hopefully as soon as possible.
You know, I always like to poke fun at attorneys, and it's sometimes kind of easy, Donna, but if there's never been a time where your attorney for an association has been more important. I mean, this is very much unprecedented. Best practices haven't even been established, and you as a board don't want to be doing anything along these lines without getting the proper advice. I just want to expand from the legal, and by the way, I don't know whether we've completely answered your questions on what happens, what if, how do you deal with the violation, but we are leaving some time to answer questions. So and I see we've got several coming in.
Well, James, one question on that. And typically with a violation, what do we threaten? Fines, suspension of use rights. Well, suspension of use rights is useless right now because hopefully you've shut down everything anyhow as part of your COVID-19 disaster plan. So threatening that we're going to shut off your access makes no sense right now. Fines do not reflect the serious nature of these violations. This is life safety that we're talking about. There is a foreseeable risk that the CDC and every emergency order I've seen has reiterated that community spread comes because of what? People who are exposed or infected continue to go about their everyday lives when they should be quarantining and practicing social distance. But social distance is for those of us that have not been exposed and have not tested positive. For those of us that have not been exposed and have not tested positive, social distancing is great. But for those who are coming from hotspots or who have already been tested positive or a member of their household has, because that's how contagious this is, you need to take the additional step and you need to quarantine. And it's 14 days, not leaving your house.
Okay. By the way, Donna wrote an article in the Miami Herald this morning, if anyone wants to get more deep into her thoughts on this. From a practical point of view, if you're in an HOA, it's way easier than a condo. I mean, if you have a confirmed case and that someone's in their home and they stay in their home, there's obviously the importance of them staying in their home can't be emphasized enough. But as long as they do that, they are not likely going to infect other people in the community because we've closed all of our amenities, and we'll talk about that in a minute. But in say a high-rise condominium, which I know many on this call are, we have developed very specific protocols about how to get people in and out of buildings and not affecting other people, and how we get their supplies in and their garbage out. And we won't go into the details of that, but happy to talk offline. And for our Castle clients, we have those written protocols. And frankly, if you're not a Castle client, we're welcome to share anything we're talking about. If I have non-Castle clients or self-managed, we're all in this together. Happy to share with anything that we've produced.
James,
Okay.
what is Castle doing? Have you encountered New Yorkers who bring their pets with them that need to be walked several times a day?
Yeah, and so that's another part of the procedure. Obviously, they can't do it all the time because it's too hard to get an infected person in and out of the building. So we have it literally what our team has to wear to interact with that person in the building. But we have one instance so far where we've had to make dog walking accommodations.
You've had to.
Yeah.
Wow.
So I want to move quickly to finances because, as usual, we're going to run out of time here, Donna. So here's the situation. We're running a business. It's called a condominium or an HOA. It's a legal entity. It's got revenue expense. We as board members have a fiduciary responsibility to make sure we take care of that. And our source of income is the maintenance payments from our owners. We at Castle are starting to get calls about, I've lost my job, I can't pay my maintenance. And so I'm going to just begin on the pure business side and say this. Our federal government has put together the largest recovery or stimulus CARES Act ever. And the purpose of that was to get money in the hands of the citizens of this country as quickly as possible. And it does it through two ways. One is this $1,200 per person, $2,400 couple, up to $3,000 or $4,000 per family one time. And that will start flowing quickly because it's going right into people's bank accounts. Secondly, if you lose your job, the federal government has added $600 per week on top of the state benefits. So in Florida, it would be close to $1,000 a week. And so the whole idea of this program was to put money in our owners and residents' hands so they can pay their rent or their mortgage or their maintenance. So I'm extremely empathetic for the exceptions, but The exceptions will be the exceptions. The rule is most people can still pay their maintenance. And so it's our belief the first step in financial health is to continue to collect the maintenance as you should. I think it is a slippery slope to send out any communication that says otherwise. And then finally, what we're talking about with some of our clients now, and we think will be well received, is if we have someone who hasn't paid and we send them out a late notice, that we include in that some links to where they can get the help to pay it. But with all that said, Donna, what is, from a legal perspective, what should our associations been doing about owners that either ask or don't pay?
Yeah. So the first thing is don't panic. Don't panic. Don't start creating lien collection protocols now without having a grasp of the full economic impact this pandemic is going to have on people's ability to pay. Not everyone in your community is going to be laid off or unemployed. You know, the bleak financial forecast is the one part of this pandemic, James, that is not uncharted territory for us. It's just not. We went through a horrific recession back in 2007, 2008. Some of our communities had upwards of 60, 70, and 80% delinquencies, particularly in our communities in Miami-Dade, where you had a large percentage of investor owners that just simply stopped paying their assessments. We also had people who were engaging in what we call strategic defaults, meaning they could pay, but they just chose not to pay their association assessments. And sometimes this is because people just don't understand the nature of association assessments. They don't understand that the association can lien and foreclose their home, even if it's homestead property. So we saw during the recession that some people had the notion that they could voluntarily stop paying assessments and they would not be foreclosed. And I still think that in some communities, you still have that misinformation out there. And that's the first thing that owners need to understand. Not paying your association assessments is not an option. Now, if there are, you mentioned all the stimulus package, you know, between the $600 that the federal government is giving, and I think it's $275 that Florida's giving, you're almost $900 for unemployed people. This is the time I would say to boards, don't start thinking about waiving interest and late fees and reducing assessments. You have to look long-term what you're going to be doing. For instance, I had a conversation with a client 2 days ago where they're considering a special assessment for a paving project. It's not an emergency, it's aesthetic. This is not the time for boards to be undertaking aesthetic discretionary projects. Certainly necessary maintenance and repair projects, absolutely, once we get past the worst of it. But you have to take into account that almost every household will be impacted to some extent, some much more than others. But boards can do a couple different things rather than panicking, rather than saying we've got to start waiving interest, because you don't really have the ability to do that. Boards have to have a consistent policy. You are charged under the statute and under your documents to collect assessments to fund essential community services. You can't just say we're not going to do it. And if you want to waive interest and late fees, you have to waive it uniformly. You can't pick and choose amongst your owners who you're going to help in that regard. The better approach, James, is for boards to start thinking source of funding. Do they have a line of credit? They may want to take cash now because a lot of banks are going to be getting requests for that, and they may at some point freeze or shut down lines of credits. So for the boards listening on this call, if you can take a line, if you can take a draw, yes, you're going to have to pay some interest, but you'll have some cash on hand to help ease the burden in the coming months if you need to. If you have reserve funds, then you may want to make arrangements to get a membership vote to use some of those funds, and that may be an option to defray to ease the burden, the assessment burden on your owners. But I think in the coming months, you will talk to council and you will figure out whether or not you want to tighten up your collection policy or loosen it up. But for right now, don't panic. You don't know the full economic impact right now. So the answer to people calling and saying, I can't pay, the answer is we still have to collect. If they need to get on a payment plan, then that's something that happens after they get the legal demand letter, not before.
I'm just looking at our timing and as we go along, and I've got questions coming in, so I'm gonna try and weave some of them in as we go along, Donna. There was a question from Peter on the line about essential service, and I did forget to mention that in the beginning. Every governmental agency that has declared and defined essential service has included property management and building maintenance as an essential service. So for those governmental entities that haven't, we've just assumed that position. On the, I think that covers association finances. I think the first payment is due today. It's April 1st. So we're gonna probably have more discussion on this next week. I want to talk about regulation, and I know CARES Act is regulation too. We've talked a bit about that, but are there any orders that are coming down? I know we talked a bit about short-term rentals, about quarantine. Are there any regulations, Donna, that you want to highlight that our board members should be cognizant of right now that are unique to this coronavirus?
Yeah, well, it's really important to know what your local county and municipality are doing. We're getting these orders in, these executive orders in fast and furiously, and they're being revised. I mean, the governor's order has been revised multiple times. Dade County has revised multiple times. Broward County has revised multiple times. You need to look and see, reach out to local council, get an opinion as to where your county is right now and what it says. I'll give you a great example. Miami-Dade and Palm Beach, their orders close community pools. Broward hasn't yet. So some of our Broward communities are saying, we're waiting until the Broward order closes it. And we can talk, you know, how I feel about waiting for that. I think in a pandemic, you want to be the first person to employ precautionary measures, not the last one. But to answer your question, yes, the orders are coming out. You need to be kept abreast of it. It could be a full-time job. The person in your community that's that resident parliamentarian, they want a job, keep them track of these orders. I'm only half joking. Reach out to your council and have them give you an opinion on the orders. But they are, look, we're all going in the same direction. Whether your county or city is the last to get there or the first, we all know where this is headed. We're headed to a peak in the next 2 to 4 weeks, and it's going to be tightened. Nobody's loosening up their orders, okay? Everybody else, if there's somebody who's slow to the dance, we're still going to get there.
Well, you said last week, and I was kind of poking fun at you, that you were way too strict, and it turns out that most regulations have moved towards your position, so I humbly apologize. We have both Dalik and Dennis have asked a question about the applicability of the CARES Act to associations, and I think that the difference between nonprofit and not-for-profit is worth a comment. And I do know, because you and I have spoken, Donna, we believe there may be future clarifications, but right now, I don't think you believe it's applicable to associations, but speak to that.
I really don't. So the CARES Act, which is, I wrote it down, Coronavirus Aid, Relief, and Economic Security Act, known as CARES, is pumping $350 billion to help small businesses stay afloat and basically keep people employed throughout the coming weeks. Here's the issue. It applies to small businesses. Well, associations are not businesses. They're kind of a unique combination of commercial and residential beast, so to speak. So they're not small businesses. It applies to 501c3s, which are educational, religious, or charitable organizations. I don't think any of our associations fall within that category. It applies to tribal businesses. Well, we're not tribal businesses. And it applies to individuals who are sole proprietors or independent contractors. So we have a real problem here. It does not apply. So I think some of the issue that's out there is that there's a 501c4, which addresses neighborhood associations. So that I think that may be the source of some of the confusion out there. But the CARES Act, in terms of the eligibility for these loans, and let's just be clear, these loans are to help businesses make payroll, and they will be forgiven if these businesses keep these workers employed. It's really a different way, in my opinion, to offset unemployment. You've got the businesses paying payroll. Otherwise, these people would go on unemployment. So long story short, right now, I don't see how associations would be eligible for those loans under the CARES Act. But if we put enough pressure, that may change. You know, I think CAI may be putting pressure on with regard to that, and it might change. Again, next week could be all different as fast as this is changing.
And I think that's why we're going to keep doing this until our audience tells us not to. So there's the answer to that question. PA asked if someone has already reserved, and I'm moving up to amenities, number 6 there. If someone's already booked a room for a celebration, can the board cancel the reservation because you can't have assembling of people? Does the board have the authority to cancel the reservation on a common area?
Yeah, so the private events, I'm assuming that PA is talking about a private event, a typical birthday party or a celebration or what have you.
It's a resident event, yeah.
Yeah, most associations canceled those weeks ago, okay? The association under the emergency powers under 718, 719, and 720 has the authority to declare certain portions of the common area off limits, okay? Uninhabitable or unusable. And that's where most boards are taking these steps. Now, there's some back and forth as to whether or not emergency powers would be applicable. We do have the Secretary of the Department of Business and Professional Regulation that did, in Halsey Beshear's order, say that certain of these emergency powers applied in a pandemic, because we all know that those emergency powers were drafted to contend with a hurricane or other natural disaster. But we do have an order from the Secretary of the DBPR saying that certain portions of the emergency statutory powers will apply in this instance. And the one that does apply is declaring certain portions off limits. So I think PA needs to talk to the board, but absolutely, you cannot keep those items open and still comply with social distancing and still comply with CDC guidelines. It's just too difficult to be able to kind of dance that tightrope. There's no reason to be allowing private parties to take place right now with what's going on.
Okay, and I apologize to the audience here. I keep looking to my right. That's where the questions are coming up, and I'm trying to make them logically flow into our conversation. But one I think is a good one that we just passed, and that is association finances. We do have a call or a question from Juliana who's asking, our board has a special assessment out there, and we would like to defer 3 payments, the next 3 payments, not eliminate, but defer them. Does the board have the power to do that?
Well, the board can go back and readdress payment terms on special assessment, sure.
On the, let's see, do we recommend? So on the amenities, just because I want to move on to community access, the next set of questions are talking about who can we let in and out of the community. But I just took to summarize on amenities. Basically, the whole idea is, and I'm using a global statement, I'm sure there's exceptions, but shut down all your amenities. Because if you don't, you're going to have assembly of people, and that's what we're trying to avoid. And there is a related question, I don't want to go too deep into it. On the amenities, the other thing we're going to talk about next week, I've already started that list on, is there is board liability for negligent acts on behalf of board members. And can you imagine if you didn't close an amenity and someone got seriously ill or died? There's potential liability, and I don't want you to answer that this week, or we'll have nothing for next week. And I want to get through the rest of these questions. But
that's an important one we got to talk about, because I will just leave you with this. I served on my own HOA board several years ago. So I feel for all our board members listening, I know the pressures you're under. I served on my own board. I would not serve on a board of directors right now that had a pool open.
Okay.
And we'll talk about why that is. And we'll talk about the potential personal liability attached to directors. So we'll save that for next week.
We also have a question from Bill that says, don't we have to reduce maintenance if amenities are not open? And I know the answer is no to that, so I won't even wait for a legal opinion. Can you borrow from reserves? You mentioned that you can, but you do have to do it in accordance with your documents.
Right, membership vote.
Membership vote, yeah. I want to talk about access to the community. There was a question there. Do you recommend restricting non-essential guests from private HOA communities? So let's just address is in terms of who should we be letting into our communities? What powers do we have to restrict? And thinking both HOA and condo here, and I'll tell you, I have a friend that lives in a condo who they're not letting family members come, and I thought that was a bit extreme. But from a legal perspective, what limits can our board put on people coming into our communities, HOA and condo?
Well, again, this is a conversation with legal counsel to see how far you can push the envelope. If I'm dealing with a 55 and over community, which is really more like an 85 and over community, where I've got a high percentage of vulnerable people in there with underlying health conditions, I may recommend a more stringent guest visitation policy. For another type of community, that's, like we want to talk about homeowners associations. For a homeowner association, I wouldn't recommend that. I don't think you need that same level of vigilance as you would in a 55 and over, where these visitors are coming in, they're in the corridors, they're touching surfaces, they're in the elevators. I think that's a more compelling case for guest limitation, for curtailing or even prohibiting. I don't think it makes sense to tell somebody that their nurse or a hospice worker cannot show up and do their job inside their unit. A housekeeper is a different situation. As a matter of fact, I had a client several days ago where an in-house keeper was, there was a picture they sent me. She was taken off by an ambulance with the mask and everything else. She tested positive. So that's what we're talking about here, folks, is minimizing exposure. That doesn't mean it's a cure-all, because you still have people. We are not under a complete shutdown. We still have residents leaving the community, going to Publix, going to Walgreens, coming back. So there is the potential that people leaving and coming back in are bringing the virus with them. But you do want to minimize the extent of exposure to your residents. And that's why you have to strike the right balance. Is it necessary for this person to come into this community? I think for social parties and friends, because people are bored, the answer is a definite no. That's not a necessary visitation that needs to be taking place right now.
Okay, and then we talked, included in access are projects, both the common area and of units. And I think last week we said, if someone hasn't started a project, it's absolute no. If they've already started a project, last week we said, let's let them finish. I think even that is up for question now. And my comment from a practical point of view for outside work in condos and HOAs, I mean, this is, we're finding it's a great time to get projects we wouldn't have had time to get done because they are outside, and it's normally done with our teammates, not outside contractors.
Well, I think that's a big difference. If you're putting your management team to work, painting, cleaning, getting to projects that they didn't have time to get to before, that makes sense. This is really a question, James. You're going to have those people on your property anyhow. That's your management team. We're really talking about bringing outside crews in. And some people think, well, they're outside. Okay, they're outside. Are they coming into the building to use the restroom? Are they touching handles? Are they touching other surfaces that your residents will come into contact with? Are they in areas that your owners need to traverse to get to their cars or get out of the community? These are all factors that need to be considered when you're talking about whether or not a project needs to proceed. By the way, if you're saying to your owners you can only proceed with emergency repairs, which you should, then the same should probably apply to the association. It's going to be very hard to see the association doing an aesthetic project that doesn't really need to happen right now while you're telling your owners they can't.
Yeah, I think we do have some communities, 55 plus, big spread out, where they've literally closed down the whole clubhouse for a complete remodel. And we've had the discussion with the board and their council, and they're thinking, well, there's no one going to the amenity, so they're going ahead with that. But those are really more exceptions. I think the general rule is restrict access if possible. We have enforcement next, and you talked about enforcement early under violations, but one of the questions from Michael was, are the courts open to hear injunctions? So let's say our only way to enforce something is through an injunction. Are the courts open? Can we do that?
Yeah, it's, from what I heard last, they are open for that. So that would be a possibility.
Okay. We have a few questions about our employees. How are management companies handling the hiring process? Are they hiring? That's a great question. You know, we're on the one hand, we're exhausted from dealing with all of the coronavirus. As I tell my team, we're lucky we're employed, and we are essential. I mean, our communities need us as managers to be there. So for the most part, it's all hands on deck. Our communities, by the way, have been exceptional in supporting the team. If they can work from home, they work from home. We talk about closing. So the answer is management teams are still working. The answer is if they can work from home, it's fantastic work from home. And the answer is, and Don, I think you're in support of this, we basically closed the management office. You can access it through telephone, email, or through our work order system. And if there has to be a face-to-face meeting, we've set up a room that has appropriate distancing. What are your comments in terms of the management team continuing to operate at these sites, Donna?
Yeah, I mean, I think people, residents and board members, if you're listening, I think keeping your management staff healthy should be a priority as well. And I've actually heard that from some people. We've talked a lot about keeping the residents healthy. You've got to keep your employees healthy too. You have to take into account that these are people who are coming into work every day under extraordinary circumstances, extraordinary strain. They're dealing and grappling with things that they've never dealt with before. So to the extent that the boards and the residents can be a little more understanding of the job that the management staff and the people who are still showing up every day to make your lives easier, it's important to do that. Also, as you well know, if you've got employees that don't feel comfortable doing something, that they shouldn't do it. For instance, you've got that quarantine person. Well, somebody has to bring mail to that person's unit. Somebody has to take the trash out of that person's unit. So you've got to be dealing with your employees and figure out what they need to be able to do their job under these extraordinary circumstances. What I'm hearing, James, is that when you've got association personnel handling the deliveries, because normally what we're doing is having people come down, and I don't know if I think Castle does this, come down for their deliveries, as opposed to having the delivery person go up unless you're quarantined, right?
Yeah, that's that is a bit property to property, but that's a good point that you want less people going into the building. You're better to have a common point where you come down to. But yes, that is being limited. And with respect to the team, I did see some questions. I don't know their name because they're not on the board, but I read them from submitted questions. Was how do we protect the team on site? And the first thing is obviously we follow to the extent we can all the distancing and personal hygiene. We're not only are we cleaning all the high touch surfaces for our residents, but also for the team. We are taking your advice, Donna, and keeping our offices closed for walk-ins and creating different systems for that. OSHA has some guidelines for this, and interestingly, OSHA has not issued coronavirus specific guidelines. But the bottom line is there's a couple different provisions in OSHA. One is just a general due care for your team, and the second is that they all have appropriate PPE, personal protective equipment. And so that's been our focus, is if we're asking people to be in very specific tasks, the extreme one being handling an infected person's material, then we have the appropriate equipment for that. We do and have had some teammates that don't want to work under certain circumstances, and we're addressing those one-on-one. This original question, I think it was from Marilyn, was, are we hiring? We're not doing a lot of hiring because there is some redundant staff, and if there is redundant staff, we're just moving them to another property where we need somebody. We are doing some limited hiring right now. And the other thing we've done is we've buddied every manager. It has another manager who they're visiting each other's properties, so that if something happens, and if you can imagine, it could be more than one teammate having to quarantine at the same time, we put contingency plans in at each property where we buddied them up. And then obviously our firm's large enough, we have a floating team that we can insert in a property if we get too many people quarantined.
But James, I'm sure you're finding, because I get this question too, well, if everything's closed down, what is the staff doing? I'm sure you're finding your staff is busier than ever in terms of the heightened sanitization. I mean, there are things that they're doing now that they've never done before. People weren't cleaning once an hour in all the common areas. I'm sure it was once a day, twice a day, but certainly not hourly in some of what we're seeing.
Yeah, and in fact, a couple areas where they're not, right? The pool tenants, our food and beverage operations, our lifestyle directors. And so one of the things I've slotted for next week, Don, is what can we do to help our residents who are in their homes or units, how can we help them enjoy themselves? And we're now putting out a weekly newsletter with here's our suggestion to how to stay engaged. But I think I'd like to expand more on that. Someone is asking, will there be a link to today's discussion? Yes, as soon as we can get it rendered, we'll have it up on castlegroup.com. We're getting a lot of questions on 55 plus, Donna. Can we create, Ken wants to know, can we create a non-essential guest policy to limit guests to the community? Who is non-essential? Can we limit people visiting from hotspot areas, realtors, non-essential contractors? I know we've kind of already addressed this, but I think Ken's question was, can we kind of formalize that policy and say, look, starting this day, we won't have any realtors, we won't have any, can they define non-essential for their—
and some of this is already defined in the executive orders that are flowing fast and furiously, which is why at the outset I said, speak to council as to which executive orders apply in your area, because some of the cities and counties have already described what is essential and non-essential. That doesn't mean you're boxed into just what your city or your county says. Boards can take it a step further, and you can customize a COVID-19 plan, particularly for your community, which is exceedingly important in a 55 and over community with their vulnerable demographic. If you're asking my opinion as to what is essential guests right now under these circumstances are caretakers. I need somebody to come in to help a member of my household with a medical problem, and a limited number of family members. Somebody could say I have 12 family members that need to come. Most communities are imposing a limited number of immediate family members. Other than that, and other than delivery personnel coming into the community and contractors performing emergency repair work, everybody else for the most part is not essential.
Okay. Helen wants to know, our annual meeting was scheduled for this month, so it was canceled. We have 2 positions open and 2 people who applied. Is there any way to put the new people on the board without an annual meeting, or can we hold an online annual meeting?
So that depends on what community is it Helen was writing from. If it's a condo, you don't need an annual meeting to have an election in a Florida condominium. You need 20% of your eligible voters to cast a ballot, and whether or not people can walk on the board depends on whether or not you have more people running than slots available. If you had more people who turned in their notice of intent to run in time, then you still need to have an election. They don't just walk on. You have your election. You don't need that annual meeting to have the election. Speak with council as to how you split apart the election from the meeting. If they're midway through the process, you can't just jump onto electronic voting right now. That needs to be done. That needed to be set up before that first notice went out for the annual meeting and election. So James, in answer to that question, we have in Florida condominiums and cooperatives said you don't need the annual meeting to have the election. We proceed with the election. Again, if you have more people running than seats available, and you can do that, you can videotape the counting and then put it out there, or you can have a limited number of people. You've got your 3-member counting committee, and you may have 3 other people observing. Space them out, and that's it. Remember, the election materials are available for inspection, so they've got plenty of time once the pandemic passes if you want to go in and look at the election materials. I wouldn't recommend doing it now. We're not recommending in-person inspections because, as we know, this virus lives on materials. If we don't know, again, we hear up to 7 days. People opening those ballots should wear gloves and protective gear.
So it is different between its HOA or a condo, but the answer to her question was, and yes, we can do it electronically.
Yeah, and even in an HOA, if it's a 30% quorum requirement, they can use proxies to mail them in. If they have a procedure where you need nominations from the floor, that gets a little more difficult. Speak to legal counsel how you can get around that.
Okay. I think we have time for 1 or 2 more questions. Then I just wanted to give you and I kind of a wrap up and talk about maybe what we can do next week. Norman wants to know, can we schedule any outside safe distancing events? See, everyone's going crazy in their units, their homes, such as safe distance walking against the virus, folks walk around the development now anyway, there would be no time schedule. It's at their schedule, morning, afternoon, or night. I think that that's a very specific question from Norman, but the more broad one is, should the association really, I mean, people are organizing their own things, but could they be organizing an outside event where there was appropriate distancing? And I guess it would apply to a condo or an HOA.
Yeah, you know, I would just ask Norman if he's heard of the saying that no good deed goes unpunished. Because I truly believe, here's the thing, with the association organizing that, unless you have a way to police it, it can get out of control. If you want to know where I think this is going to head in the coming weeks and months and years, there's always a cottage industry, I hate to say this about my own profession, of attorneys that crop up that are looking for associations that do something wrong. We've seen this with ADA tester lawsuits. I'm sure you've seen those, James, where they go around and they see whether or not you are ADA compliant. This is particularly true for our resort style condominiums that are open to the public, or communities that have short-term rental activity. We've seen it with FDCPA violations in terms of the way the associations pursue their delinquent accounts. And this will be no different. There will be a cottage industry of attorneys months down the road that are going to be looking to see which communities took which steps and which took steps that may be considered reckless.
Excellent. Well, we're bumping up against our time, and we want to respect everyone's calendar. If I could just summarize, I'm looking at the kind of the 10 things we wanted to talk about, Donna. Obviously, we gave an update on what happened between last week and this week. We got more granularly into what happens if you have a confirmed case, and I'm going to suggest we carry that one forward to next week, because we're going to get more scenarios, and we're literally gaming scenarios now at Castle. What if, so that we try and get ahead of it. In terms of the association finances, it's a primary responsibility of the board. Take a look at your balance sheet. Take a look at your surplus operating cash, your possibility of using reserves. Take a look at your line of credit if it is there. If it's not, your management company can help you get that arranged. Consider actually drawing down your line of credit. Our position at this point is really collections as normal, and help our owners with the programs that have been put in place to be able to pay. The regulations keep coming. I think that'll be a recurring one, Donna. The CARES Act, right now, we think the benefit is to our owners so they can pay their maintenance, but we don't think it is applicable to associations. That may change this week. Amenities, close them, and amenity and access to community, be smart, and limit. Enforcement, I think an aha for me, Donna, was how many enforcement tools we do have that maybe the board didn't know before today's call. On employees, we need to keep them safe, and they're all, almost our whole industry is working. As you said, it's working hard. And I hope we did a little better job with our HOA answering today, and with each item kind of differentiate with that. But Donna, before I kind of tee up next week, any closing comments for our audience this week? You've done a great job.
Yeah, I want to touch on HOA really quickly, because I know we've got HOAs listening. Not every homeowners association community is identical. Obviously, the community, some are single family homes with no common amenities other than patches of grass, and that's it. But we've got other HOAs where they're attached townhome communities. They live in closer proximity to each other. So a lot of things that we're discussing with regard to condos may apply to those homeowners associations where their infrastructure is more similar, James, to a condominium. For the other HOAs, you still have all of the same issues when it comes to making decisions. I would say to our board members on the phone or joining us, that the courts have given pretty significant deference to the decisions that boards make in their business judgment. So there's a thing called the business judgment rule. Boards are not held to a standard of perfection. If they were, we wouldn't have anybody serving on these boards. That's number one. But you have to exercise reasonable business judgment, and the courts have given pretty significant deference to those decisions. So this is why it's important for you to reach out and listen to counsel and the other experts that are helping guide you. I know you're going to have to make some unpopular decisions, but if 6 people want your pool open and you've got 300 people in the building, you really have to do a risk assessment as to what is riskier, leaving it open and having one of the other 300 people claim that they got ill or that a member of their household died because an infection raged, or the 6 people that want to continue to swim laps at the pool. It's not about the pool or the water or the fact that you got a pool that's big enough for 50 people and only 60 are using it. It's the surfaces. It's the little railing that you use to get out of the pool and take yourself out of the pool. It's the surfaces, and unless your association has the manpower to be out there 24 hours to maintain that everything's being done right, everything's being sanitized, I don't see the upside in not taking a stringent common area closure approach.
Thanks, Donna. Okay, I'm gonna just close it off. I'll say, first of all, we sent out a survey last week after our episode, and we got incredible feedback, including this Q&A format, which I hope has been well received. We have a lot of questions. We've had over 300 people on again today, so as long as that keeps up, we'll keep doing them. I think that, the bottom line here is this curve they keep talking about is a function of us staying healthy, and the way we stay healthy is to do all the things we're told to do. And as Americans, that's not very easy for us to do, but we must. So we're going to send a survey out after this one as well. The more you give us feedback, the more relevant our conversations will be. If anyone wants to revisit or share this, probably by the end of the day, it'll be up on castgroup.com. And we have already got a good list of topics for next week. So can't thank you enough for your leadership. This is the time where our owners and residents are looking for calm, cool, collected, strong leadership. You're not going to satisfy anyone, as Donna said, but we're here to help you do that. And we look forward to talking to you next week. So have a great one. Stay
safe, everybody.